What is big data? Big data is a relatively new term that has been gaining popularity and is being touted as the key to uncovering new and valuable insights. To give you an idea of how big is, consider this. The amount of data created in the world from the beginning of time up through and including 2005 is now created every 2 days. In healthcare alone, it is estimated that data volumes globally have reached 150 exabytes. That's equivalent to 150 million terabytes in size and is growing at a rate of 2 exabytes per year. This explosion of data is creating new opportunities to not only save money through more efficient use of information, but also to analyze broad population health data to discover new trends which can lead to more informed clinical decisions and improved outcomes. For example, analyzing the data gathered across your community can allow you to identify groups or individuals who are at risk for certain diseases, or who may benefit from proactive lifestyle changes. By comparing clinical outcomes across various populations and demographics, you can discover evidence on the effectiveness of different treatment options which can be used to create more effective, targeted treatment plans for individual patients. By learning how to truly leverage big data, you can improve care delivery and enhance every aspect of your organization as a business. To do this, you must harness the 5 V's of big data. Volume, which is the amount of data that is collected and stored. Velocity, the speed at which data is generated and accessed. Variety refers to the wide array of data sources and formats. Veracity, the variability of data structure and quality. And finally, value, arguably the most important V, which is how you can get the most out of your data. Today, more so than ever before, patients are taking an increased interest in their healthcare, searching for their own care providers at a variety of institutions. The data that is gathered can come from a collection of traditional and non-traditional sources, and exists in a wide array of formats, such as X-ray scans, physician reports and notes, or even data from monitors or wearable technologies. Together, this data is creating a flood of new health information. Each piece of information is an individual piece in the puzzle, which together forms a picture of the patient's overall health. Unfortunately, this data is woefully underutilized due to challenges in data access and format. Data is often fragmented across multiple individual systems, making it inaccessible outside of the institution in which it was acquired, leaving physicians in the dark regarding potentially relevant history which may exist for their patient. Variances in data formats lead to interoperability problems between systems. Physicians often need to log into multiple different systems, each with different credentials, in order to gain access to bits and pieces of the patient record. When systems and data are isolated like this, caregivers do not have all of the information they require in order to make informed clinical decisions, which in turn can lead to unnecessary duplicate tests, delays in diagnosis and treatment, and ultimately, suboptimal patient care. The solution is a patient-centric, cross-enterprise, content-agnostic data warehouse which allows healthcare communities to share and access patient data, regardless of its source or format. Advanced connectivity tools which provide a patient-centric view of your data will allow you to discover, aggregate, and normalize patient records from anywhere across your community. When combined with a universal viewer capable of displaying a wide variety of data formats, physicians will be able to diagnose patients using a single application at any time, from anywhere. Selecting a system which adheres to the latest industry standards and profiles for interoperability, such as DICOM, HL7, and IHE, will allow you to seamlessly integrate IT solutions and share data across the enterprise. Finally, the solution should be content agnostic so that data is always stored in its native format and nothing is ever altered or wrapped, so that any department contributing to a patient's care can also contribute to their clinical record. By distilling information from across your healthcare community, you can create a single, integrated, actionable patient record, providing caregivers with relevant clinical history at the point of care, and most importantly, delivering timely, quality, cost-effective care for patients.